You are listening to the Aging Starts Now podcast, where it's all about responding with confidence to the legal, financial, and personal challenges created by a disability, unexpected illness, or aging in general. Join us weekly as elder law attorneys Barbara McGinnis and Chris Johnson, along with other members of the Johnson McGinnis Elder Care Law and Estate Planning team, talk about the tools, techniques, strategies, and services that will make the elder care journey easier for everyone involved. Get ready, because aging starts now.
Welcome to Aging Starts Now, the podcast by Johnson McGinnis Elder Care Law and Estate Planning, where we explore the issues that can arise with age and disability and provide practical information for older adults, caregivers, and families. I am today's host, Erin Keogh-Rankin, one of the Elder Care Coordinators at Johnson McGinnis, and today we're talking about a very important topic that unfortunately does not get enough attention. That is suicide prevention among older adults. Joining me today is Fiona Hoehn, Mental Health Training Coordinator with Mental Health America of Middle Tennessee. Together, we will discuss the warning signs, risk factors, how to have difficult conversations, and the resources available to help save lives. Fiona, thank you for joining us for this very important conversation.
Yeah, thank you so much for having me here, Erin. I'm really happy to, speak to this topic today.
Yeah, absolutely. Well, let's just get right to it, shall we?
Yeah, that sounds great.
Yeah, can you give our listeners an overview of how prevalent suicide is among older adults in the United States?
Yeah, so I do have some statistics about that. So we know that older adults make up around 17% of the population in the United States, but unfortunately they make up almost 22% or, almost a quarter of all suicides. So it is an unfortunately high prevalence. We also know that 1 in 4 suicide attempts in older adults are fatal, compared to 1 in 200 youth suicide attempts.
My goodness. What factors would you say make older adults especially vulnerable to suicidal thoughts and behaviors?
So all of the risk factors that apply to, people of all ages still apply to older adults, but in particular, for older adults, some of those risk factors look like things like cognitive functioning and dementia. If that older adult perceives themselves as a burden to their family or to their community or loved ones, if they're also experiencing a loss of independence, and that could be needing to have additional kind of support or needing support in a care facility. We also see medical diagnoses, which is also kind of related to that independence and that burden part or perceived burden part. And then I think a big factor that, most people would probably think of is that element of loss or experiencing loss or bereavement with, losses of family, friends, spouses, which can also lead to isolation for older adults. And that's where that can be, really tricky for people.
Yeah. Do you find that older adults are perhaps stating that they no longer have a purpose?
Yeah, I mean, that definitely can be part of that, not having that purpose or not having, a sense of belonging, I think is a strong risk factor. So, unintentionally becoming more isolated because of the loss of some of those relationships, that really, makes it more risky for somebody to start, developing some thoughts of suicide.
Right. And, as you said earlier, as far as their perception, right, that being a burden. And clearly we all have a purpose in life, regardless of how many candles are on our cake, right?
Definitely.
Yeah, definitely. What would you say one of the challenges is recognizing when an older adult may be struggling? What are some of the most common warning signs of suicidal ideation?
Yeah, that is a great question because we see similar warning signs amongst people of all ages, but Some of them are a little bit more nuanced when we're talking about the older adult population.
Mm-hmm.
I think that in general, a warning sign of suicide is, somebody talking about suicide, talking about wanting to die. And that becomes much more nuanced when we have an older adult population, because talking about and preparing for death, that's developmentally appropriate. It makes sense, right? We're planning for end of life care. We're planning for the future, planning for our families. So that totally is developmentally appropriate. But that is also different from talking about wanting to die or talking about suicide. So I think for folks hearing from their older adults in their lives, really paying attention to how they talk about end of life care or end of life planning. Are they saying something like, my life isn't worth living anymore, I'm just tired of life? That's a little bit different, right, than planning for the end of their life or planning for, beneficiaries or what happens with their home or things like that. So that's, I think, a really kind of nuanced warning sign.
Mm-hmm. Mm-hmm.
In general, some of the other warning signs could be, if somebody has experienced a previous suicide attempt, that's the highest predictor for death by suicide.
Mm-hmm.
Also, a sudden interest or disinterest in religion. If somebody is avoiding social activities, that kind of points back to that isolation piece that I mentioned earlier. If they're withdrawing, from that social world or from family or from things they like to do, if they no longer have a concern over their personal safety, those are some kind of high level warning signs that you want to pay attention to.
Yeah, I appreciate you sharing that. Fiona, it's not uncommon when we here at Johnson McGinnis meet with family members, with clients, and they are, preparing for their establishing their end of life care plans, right? And family members, there would be a client that says, I just don't want to be a burden to my children. Does that necessarily equate to, oh my goodness, I need to be concerned this person is having a suicidal ideation?
That's a great question. So I think that could be something that maybe you can investigate when you do hear that, because I think that can be very well intended and, looking into, how do I support my family? How are they, well equipped to support me? And, after I'm no longer here. And also that could be something that maybe we hear and we ask someone about, like, what does that mean? You don't want to be a burden? I want to help you or take care of you or support you. So, what does being a burden mean? And maybe that could be a little bit of something that we investigate a little.
Sure. Follow-up questions are very critical, aren't they?
Definitely.
Yeah. Kind of like, tell me more.
Exactly.
Right. What would you say as far as what role does substance use, such as increased alcohol consumption or misuse of medications, what role does that play in suicide risk among older adults?
So that is a really good question, too. We know that when people are using alcohol, alcohol in general makes you more impulsive and less inhibited. So that can be tricky when dealing with suicide, because suicide is often impulsive.
Mm-hmm.
Suicidal thoughts are not necessarily impulsive, right? Somebody might deal with that for a long time. But when they're in that acute kind of distress or pain, that's usually a shorter term crisis. And substance use can really kind of make that moment a little bit more less inhibited. So somebody might be more impulsive, especially if they do have means for suicide, with them. And then I think also with substance use, watching out for stockpiling medication, that's also an important factor.
Right. And would you say, as far as with men are more susceptible, or women, is there a particular status there or statistics rather where the men would attempt and complete suicide has a more successful rate. I think you alluded to that earlier.
Yeah, so there is a lot of data to show that I believe it's men over the age of 85 have a higher suicide rate. In general, I think we want to really pay attention to older men over the age of 55, but especially when we get into the upper age, 85 and older. Older men have definitely been at higher risk for suicide. So that's an important age group to pay attention to, especially if they also have access to firearms or some other types of lethal means.
Right. Because again, we here at Johnson McGinnis with life care planning, we as elder care coordinators, we walk alongside our clients and their loved ones. As their health needs change, then so too do the frequency of visits and contacts and what have you. And I'm always concerned about when there's a change in their status, mental status, and or if family members are expressing a concern that, mom is starting to have these thoughts or what have you. And my first thought is, are there firearms in the house, right? We need to create a safety plan for sure. So I definitely think that's something that a lot of people need to take into consideration. Take whatever your loved one is saying, take it seriously.
Definitely. I definitely agree with that.
Yeah. How would you say that depression, what role does depression play when it comes to suicide among older adults?
Yeah, so depression, I think it does not mean that somebody will be suicidal. Somebody can have depression and not be suicidal. Most people with depression do not become suicidal. And on the flip side, many people who attempt suicide are moderately or severely depressed. I think that means that when we see someone, especially an older adult who is struggling and maybe experiencing depression, making sure that we're noticing those signs, that medical providers are doing those assessments or screenings to make sure that they're noticing if someone is experiencing depression. Because with the older adult community, I think I mentioned earlier, we see that 1 in 4 suicide attempts are fatal.
Right.
And that's often due to a lot of factors like frailty or somebody living alone and not being able to get help when they need help or as soon as possible. So we really want to take action, even if somebody is not expressing suicidal thoughts. But, that depression is still an element of a risk factor. Again, it doesn't mean that somebody will be suicidal, but I think especially when caring for our older adult populations, we don't want to let that risk go unnoticed.
Right. And again, with a society the way that it is, I have found, I myself am a senior, and older adults, the generation, my parents' generation, especially my grandparents' generation, there was no discussion of suicide. Right. And it was such a taboo subject. And if there was a family member that had attempted suicide, and thankfully the attempt was not successful and family member is being well treated and monitored. But does that mean that suicide is genetic?
Oh, that is a great question. I would say, I can't speak to that specifically from my knowledge. But suicide is a perceived solution to a problem or challenge that someone is experiencing. Certainly, a lot of mental illness can have some heritable elements to it. And also, just because somebody is maybe more likely to develop depression doesn't mean that they're likely to also become suicidal. So we're really looking at how is somebody, do they have the coping strategies? Do they have a support system if they do develop some type of mental illness? And really knowing that somebody is seeing suicide as potentially they're in acute distress or acute pain.
Right.
And that's what they're perceiving as maybe a solution in that moment. And that's kind of part of that. But I wouldn't say that it's hereditary or genetic, but there are certainly some elements of mental illness that can be hereditary. But we are all, at risk of developing mental illness or, experiencing mental health challenges as well.
Right.
Anybody can, unfortunately, develop thoughts of suicide regarding, their mental health, or even if they're not experiencing depression. Mm-hmm. So we can all be at risk of that. So that's why it's so important for all of us to know how to respond and how to help somebody when we do notice that, they are showing those warning signs.
Right. So the differential factor then is the coping strategies. That's what I'm hearing you say.
Yeah, I think that having a great support system and being able to share when you're noticing, and for that support system to be educated, and that's I think just so important for all of us to learn those warning signs and what to look out for, because we never know if we're going to be struggling or if somebody we really care about is going to struggle. And for that other person to be able to turn and recognize and say, hey, you know what, I'm noticing that you're struggling and I want to help and I want to get you help.
Right. I love that. So instead of just point blank asking, hey, are you considering suicide? Or are you having thoughts of suicide? I mean, because that's a difficult conversation to have for somebody, because I guess they might be afraid that if they put it out there, does that mean this individual is going to act on that thought?
Yeah, and that's definitely a very, very pervasive myth in suicide prevention. Honestly, something that before I started working in this field, I also was concerned, if you ask somebody, will that put that idea in their head? Mm-hmm. And we know that actually it usually lowers the anxiety of the person who is experiencing thoughts of suicide, and, lets them know you're a safe person, you're willing to help them, you're willing to have a serious and real conversation with them, and that you're a safe, person to have that conversation with. Mm-hmm. So if we notice that, we definitely encourage people to ask if someone is thinking about suicide. If you feel like you are not able to, for whatever reason, be it time or your relationship to that person or your own personal history with suicide, that is more than okay, but to find somebody else who can ask the question.
So what should that individual do then? Let's say that I approach, a loved one, and the loved one gives me an affirmative, yes, I am thinking about this, and they are in acute distress. So what is the next step?
Yeah, that is a great question. So before even getting into that, I will say there's some really wonderful trainings out there that can guide you through what those steps are and how to easily remember them. Okay. Trainings like Question, Persuade, Refer, or QPR, which I do also teach. That's an international training for suicide prevention. And there's a few other evidence-based trainings like that. But basically, they encourage us to, ask somebody how they're doing, ask the question, are you thinking about suicide? And then also moving into a place of, being caring, encouraging them, giving them time and space to talk about what they're dealing with. And then the last, and I think really important step, is to make sure we are referring them or connecting them to some kind of help, whether it's bringing them to their medical provider, or saying, making a follow-up appointment with a medical provider to speak with them, encouraging them to speak with a mental health professional or behavioral health professional, or if it's, speaking to somebody else who's maybe more informally filling that role in their community and, getting some help that way, or using even like a national resource like 988, making sure that we're still doing that last step of referring somebody to getting help in some way.
Right. So the 988, can you tell me a little bit more about that? Is that a crisis intervention line?
Yes. So 988 is the National Suicide Prevention and Crisis Lifeline. That's the full title. They are a national number that you can call, you can text, or you can chat with them on their website. So they're really accessible. When you reach out to them, you will be routed to a mental health provider in your area, and they will talk you through what to do in that crisis. So, you as the loved one or the person helping or intervening can call, or, the person who is struggling can also call and reach out, and they'll help them in that situation and give you guidance on some next steps or what's needed.
And would that line be confidential, Fiona?
So the line will be confidential, and 988 will also, they have the option to, reach out to emergency services if needed. So in the case that, they're speaking to someone and that person says, that they have taken an overdose of medication, in that case or similar cases, using their own kind of risk assessment, 988 does have the ability to, reach out to emergency services. Mm-hmm. But it's a really great resource. It is so helpful. They have it in multiple languages, and they have, so many great resources on their website as well.
Well, in Mental Health America of Middle Tennessee, you all are an incredibly great resource, that's for sure. Can you tell us about Mental Health America's mission and some of the resources you provide for older adults and their families in addition to 988?
Yeah, of course. Thank you. Yeah, definitely. So our mission is that we want to improve the lives of people living with mental health challenges, want to advocate for them, educate providers, and also connect people to the right help at the right time. So through that, we have a caregiver support program. We provide families with free personalized one-on-one sessions with a certified dementia specialist. That's a really great program run by my colleague, Lynn Wood. And we also have a lot of other programming that's available for K through 12, for professionals, continuing education opportunities, first responders, and community members. So we really offer education, training, and support for people of all ages and dealing with challenges along the spectrum.
I love that. Yeah. You don't know what you don't know, right?
Exactly.
And so I'm so incredibly grateful to have Mental Health America as a resource for our clients here at Johnson McGinnis. As we conclude, what's one message you would like most, as we conclude, what's the one message you would most like older adults and their families to remember about suicide prevention?
I think the most important message is that if you notice warning signs in yourself or in a loved one or someone else in your community, to please act on it and address what you're seeing or hearing, and make sure that you are supporting that person, getting that person some help.
Great. Thank you. Fiona, thank you so much for sharing your expertise and helping us better understand how we can support older adults who truly may be struggling. Conversations like this can make a difference. And if your family is facing questions about aging in place, caregiving, long-term care planning, or protecting a loved one's future, the team at Johnson McGinnis Elder Care Law and Estate Planning, we are here to help. Visit us at www.tn-elderlaw.com or call our office to learn more about our elder care planning and support services. Thank you for listening to Aging Starts Now. If you enjoyed today's episode, please subscribe, share it with family and friends, and join us next time as we continue exploring the many aspects of aging well. Until next time, remember, aging starts now. Join us next week for another episode of Aging Starts Now.
Thank you for listening to the Aging Starts Now podcast. For more information about today's show, visit tn-elderlaw.com, click on the Free Resources tab, and then click on Aging Starts Now. You'll find the show notes there. And while you're at it, why not check out all the free resources available at tn-elderlaw.com? Document downloads, the Johnson McGinnis blog, educational videos, informative articles, helpful links, a TV show, and more. It's all there, free for the taking. If you enjoy listening to the Aging Starts Now podcast, please subscribe, rate the show, or leave us a review. It's easy to do on whatever app you use to listen. We would love your feedback on the show. Aging Starts Now. We'll be back next week with more candid discussions about the challenges created by aging, disability, and unexpected illness.